Hey everyone, welcome back to Gentle Dental. I'm Dr. Sarah Chinnery, and today I am just going to kind of go through what an regular, like one doctor, one hygiene schedule would look like, because usually not something that a lot of people understand. And it's really important to know kind of like where you are on the schedule, how much time you actually have with the doctor, how much time you have with hygiene, all of that. So let's get into it. Typically, a one doctor has at least two columns. And so on this left side, we have the first column and the second column is there shown, and then a hygiene column. So when you're thinking about schedules, on the first column, they usually do like high production things or things that take a little bit longer. So like a crown or extractions or lots of fillings, or even they have like implants or anything like that. Second column is usually like limited exams, so like emergencies or checks, labs, and a lot of the time, assistant will, if they're trained to do the labs, they'll actually be there for most of the appointment, and the doctor will just do a quick check. Any type of follow up, if you're checking healing or things like that, will be in the second chair. So either, if you think about it, it'll be like if it's low production or if it's diagnosis, that would be on the second chair. And then sometimes there will be like kids under 12 for hygiene will be in that column, because the assistant can do most of the work, and then the hygienist can just pop in and verify and touch up anything that needs needed, and then the doctor can come do the exam. So thinking about that, the third column, hygienist column, but the dentist is still semi-involved, because even though the hygienist, and if they have a hygiene assistant, they're collecting all of the data for the dentist, especially in like a new patient, if it's needs a scaling or root planning or a deep cleaning, then that's not going to be performed that day typically. And so the dentist is needed at some point, and it obviously depends on the dentist and the hygienist and how they work together. Sometimes as soon as the information is collected, they'll be able to, tell the dentist that they're ready for an exam anytime. And that works out usually pretty well, so that you don't have a bottleneck hold up. We don't want to hold up hygiene if we don't have to. So typically we just like pop in wherever we can. With the general cleanings, a lot of the times they're, unless it's a perio maintenance, which is every 3 months, or if it's an SRP, the deep cleaning, the dentist is not needed, because typically you get 2 exams per year. So sometimes that's just a hygiene appointment. But besides that, if it's just a regular cleaning every 6 months, then the dentist also has to come in and check and make sure there's not any cavities or any oral cancer or anything like that. Even though it's a hygiene column, the dentist is still involved. So when you look at the schedule, I kind of put it here so that you have a 30-minute gap between the crown start and the limited exam, so that you're starting the crown, it takes about 6 minutes to get numb. You're scanning, you're getting prepped, all of that stuff. And so hopefully you're basically done with the prep by the time the limited exam is here, their information is collected, and they're ready for the exam. Currently at my office, we have everyone just lined up whenever can come in. And a lot of the times I'm not needed for an entire hour. And then at one point, 3 people need me. And I'm just like, this is not efficient. If you're running late, if you're a new patient, especially, and you're not 15 minutes early, like could ruin like the rest of the day for the dental staff. And that's not to be dramatic, but that's like an actual realistic thing. Because if you're scheduled at a certain time and you only have a lot of time, like at my office right now, I only have 3 chairs that are functioning. So I have 3 columns, and so if I run over, which I do sometimes, then the rest of the schedule crumbles. And we obviously try to respect everyone's time, but that is like a realistic thing. And so if you're late, or if you're coming for a limited exam, you cannot expect treatment. I've had a few upset people recently, and I'm just like, they literally put you in, because that's the other aspect too, is like for us, we have a call center. So the call center is putting them into the chair too, which is what they're told to, and they're not promised treatment. It's just to look, to see, diagnose, and then reappoint. But if you're in pain, then, it's one of those things that like we would love to be able to help you. It's just our schedule does not allot that time. So if someone cancels or doesn't show, then we can help you. But a lot of times we don't know that. So we're trying to keep on schedule so that we can respect everyone's time. And we're also I'm only one person, and I am having 3 chairs to run technically. and I'm supposed to be sometimes in 3 places at one time. And so just know that, like, typically if you're getting a crown done, there's 2 other people that the doctor is going to be diagnosing, treating, checking, all of that. So sometimes, even like with the labs, sometimes that's more involved with the doctor. And so that pulls their time. So sometimes the schedule looks like, oh, it's not that bad. But if the doctor has to be in 3 places at one time, it's not possible. Like, I cannot split myself in half. So just understand that there is a system to how things are scheduled. It's very different than what medical, I think, is just one column and it's like 30-minute slots, or, so maybe they have 2 columns, but there's dedicated time per person. And also, like, most offices it seems to be running over, but they also usually have rooms to hold people. And for, like, my instance, I only have 3 chairs. I would just say, if you're running late, I would just not expect a lot to be done that day. We can collect some information, but just know that we're not going to get through everything because we just don't have the time. Make sure you have your medications, your doctor information. If you have extensive medical history, to get that all sorted. Write it down if you don't remember. If you have like a My Chart or something, that's super easy to just show the assistant so that they can just take everything information-wise. Because again, your medical history dictates a lot of things that we can do sometimes. So we're not trying to be sticklers or anything. We're literally just trying to make sure that your health is our top priority. I hope this gives you a little bit of a big picture of like how we're working, because I know we've talked about it previously, but I just wanted to make kind of like a sample chart of like, okay, if I am doing extractions and I have a limited exam and a lab and, check on the cleaning, or, the new patient exam, all that stuff. There's like a lot of little factors going into it on when I can go check, what I can do. Do I go numb and then do the check? Do I go check on the limited? Like, all of those things are things that doctors have to think about. And it's not just like a simple, like, one column, everyone gets the same amount of time. We measure things. So the other aspect too is, if you cancel or you don't show, don't expect that same time to be allotted to you immediately, because it's precious time, especially if it's a high production thing. I'm not going to get into the details of, maybe I will later, with how things work with finances. The money aspect, crowns obviously are a higher expense. A lot of extractions are as well. And that's why the chair 1, or like a lot of fillings, chair 1 is the high production, and then chair 2 are smaller things, and then the hygiene is hygiene. So just know that it's strategic. With like, I'm at a community health center, so it's a little different, but at a private practice, you are trying to hit a certain production goal every day. So you're wanting to make sure that your expected amount of money is going to be completed that day. And that is not just to make the dentist a lot of money. It's to make sure that they can pay the staff, and they can pay their lab bills, and they can pay for the building and electricity and supplies. Everything is very expensive, as we all know, with inflation, especially, and dentistry has not gotten any cheaper. So understand that it's a business, right? They're just trying to keep the lights on at some point. So there's a bottom amount that is required to keep things flowing. And so they don't have to fire people, or they don't have to limit things. That number, that's how they schedule, is so that they can hit that number daily, so that they can keep going. Again, it's just a business. They don't teach us that in dental school, but that's how it is functioning. So that's why chair 1 is high production, chair 2 is low production usually. Those spots are not just, if you're 5 minutes late, like, make sure you call the office ahead of time to make sure you can be seen that day. Because especially, I worked at a practice that I've had 9 ops, 12 ops. It's just a madhouse. There's a lot of moving parts. There's a lot of assistants. There's a lot of doctors. Like, it gets really crazy and really hairy. So again, like, typically the doctors would have certain rooms to use, but sometimes things would overflow and you'd be running late, and it just kind of got crazy. So just know that there's a system to the madness, but just be respectful, making sure that you can be on time. Early is even better. And just know that if you don't get as much done that day, you might have to be reappointed and do it again later. So I hope you have a great day. Thanks for watching Gentle Dental. Please subscribe, comment, like, all the things, and we'll chat with you soon. Bye.